Scaling and route planning. So scaling and route planning, SRP. So what is scaling? It is an instrumentation of crown and root surfaces of the tooth to remove plaque, calculus and stains from these surfaces is known as scaling. So instrumentation of the crown and root surfaces of the tooth to remove the plaque, calculus and stains. And what is root planning? Root planning is the process by which residual embedded calculus and portion of cementum are removed from the roots to produce a smooth, hard and clean surface. So scaling is removal of the hard deposits on the crown portion and crown and root portion, and root planning is removal of the hard deposits on the root portion. What are the objectives? To restore gingival health by completely removing plaque, calculus and endotoxin from the tooth surface that provoke gingival inflammation. So we have to restore the gingival health. How will you restore the gingival health? By completely removing the plaque, calculus and endotoxin, and suppression and elimination of the pathogenic periodontal flora. These are the objectives. So we have to restore the gingival health and suppress or eliminate the pathogenic periodontal flora, and shrinkage of the deep and pathological pocket to a shallow, healthy gingival sulcus. So we have to remove the reduction of the size of the pathological pocket to a shallow, healthy gingival sulcus, and conversion of inflamed, bleeding, suppurative pathogenic pocket to a healthy gingival tissue. If we do scaling and root planning, the inflamed tissue become healthy and providing a root surface compatible with the re-establishment of a healthy connective tissue and epithelial attachment. So root surface is compatible with the re-establishment of the healthy connective tissue and epithelial attachment. So the objective, these are the objectives. And what are the indications of scaling and root planning? So root planning is the cornerstone of all periodontal therapies. It can either be a definitive therapy or a pre-surgical therapy or palliative therapy or a maintenance therapy. So root planning is the cornerstone. It is present in all stages of the therapies. And psychologically unprepared patient, then go for SRP. And geriatric patient who cannot sustain trauma of the injury, then go for SRP. And medically compromised patient who are not fit for periodontal surgery, these are the patient or the indications for SRP. They can't fit for periodontal surgery. And other indications are aesthetic consideration, and where severe gingival treatment, especially in anterior segment, surgery would be unacceptable. And extremely advanced cases wherein pocket eradication by surgery is not practical would be impossible. So extremely advanced cases and aesthetic considerations, these are the indications for scaling and root planning. And what are the contraindications of SRP? In shallow, healthy sites, in absence of local irritants, there is no inflammation in the gingiva, then no need for scaling and root planning. If there is presence of any calculus and plaque and inflammation, then go for scaling and root planning. And what are the advantages? Interrupt or stop the disease progression. So we have to stop the disease progression and induce positive changes in the count and content of the subgingival bacterial flora, and create an environment that encourages the tissue to heal and the inflammation to be resolved. So we have to create the healthy environment and reduces the count and content of the subgingival bacterial flora. These are the advantages. And increase effectiveness of patients' plaque measures and securing biologically acceptable root surfaces and preparing the gingival tissue for the surgical procedure. So we have to increase the effectiveness of patients' plaque measures. These are the indications of SRP. This is all about SRP, that is scaling and route planning.